Can you briefly explain how this tummy tuck procedure is performed?
Tummy tuck procedure has got two components. One is about the skin, and that means you're just pulling down the skin and then you're cutting the excess skin under the belly. The other component is something to do with the muscles inside. In women after the pregnancies, these two strap-out muscles here during the pregnancy is split apart, so that it just has got a divergence of the muscles here, and that's why the patient has got sort of bulge after the pregnancies. This, as I said, the result of the muscles not covering enough the abdominal cavity. So when you do classical liposuction or full liposuction, full abdominoplasty, tummy tuck, the first step of the procedure is correction of the looseness or the divergence of the muscles here, like I'm doing this one, so that the muscle cover would be more sort of snug around the abdomen, and then on the skin and the subcutaneous tissue, you're just pulling it down, and usually the area that the skin under the belly and just on top of the pubis, this the area would be taken out.
What is the difference between mini, normal, and extended tummy tuck? How do you decide?
Well, how I decide, because the looseness of the abdominal skin, would tell you what you're gonna do. But with the mini tummy tuck, it's not something common, because when you do mini abdominoplasty, mini tummy tuck, actually you're not gonna change the position of the belly here, but if there's too much looseness and everything is fine on above the belly, but under the belly, if there's a sort of loose skin there, you can do the cut the skin out there without touching the rest of it. That is mini tummy tuck. But in ordinary abdominoplasty, you're expected to pull down the whole skin, starting here and going all the way up there, and then, as I said, the skin between the belly and the beginning of the abdominal area here will be stretching out and covering whole abdomen. And that means the skin under the belly will be out. Okay? So when you pull it down, you will open a little hole here, so the original belly of the patient will be coming out through that hole. Extended abdominoplasty is something to do with around here, because ordinary abdominoplasty will be more effective in the middle and will lose the effectiveness on the sides. When you do extended abdominoplasty, you can extend the skin all around here, so that you will be addressing the problem on the sides as well.
Okay. How long does the tummy tuck procedure take?
Well, in my hands, about 3 hours. I'm talking about the ordinary abdominoplasties.
Is there any difference between male and female tummy tucks?
Well, of course there is, because in a male patient, you're not expected to have some muscular problem inside, because they would not be having any pregnancy. But in some patients, if they are having too much intra-abdominal fat, that means early in their lives, if they were fat, too much. And this would have the same influence on the pregnancies in terms of applying internal pressure to the muscles. But I've never seen any patient, that had the muscle problem as in women. But theoretically, it's possible.
Okay. How long is the recovery period after tummy tuck procedure?
A little bit longer than the ordinary procedures in plastic surgery. I think the abdominoplasty is the procedure that requiring more than any other procedures in terms of recovery and going back to their normal life. And that means, I would say, at least 10 days, but I would always give 2 weeks. As I said, because the internal side of the procedure is the one that a patient will be sort of suffering or feeling not comfortable for a long time.
And what is the location of the scars after the tummy tuck procedure?
Just exactly where abdomen ends and where pubic starts, and they all have a sort of crease here. That's a natural crease, and it's exactly again the same incision line that in cesarean section the gynecologists are using. So this incision is something on the natural line.
Can tummy tuck surgery help losing weight through liposuction?
Well, no. I mean, I would say none of it would be serving the purpose of losing weight.
When patients will be able to return to work after tummy tuck?
As I said, one month.